Local anaesthetic gel is applied inside the urethra, and if required, an additional injection of lidocaine, 5 to 10 milliliters, is placed bilaterally to the urethra at the 3 and 9 o'clock positions, 5 to 10 minutes prior to treatment. The Bulkamid system is introduced into the urethra and the bladder inspected. A local anaesthetic gel may be applied to the rotatable sheath to act as a lubricant and to provide additional patient comfort during the procedure. If the patient has not emptied their bladder prior to treatment, this can be done by retracting the optic from the rotatable sheath. Then, reassemble the Bulkamid system and advance it until the tip of the rotatable sheath is adjacent to the bladder neck. Adjust the camera so that the 12 o'clock position on the screen corresponds to the 12 o'clock position of the needle in the sheath. Open the blue inflow tap on the irrigation tubing and close the red outflow tap to allow 150 to 200 milliliters of water into the bladder. This will help to stabilize the urethral wall during each injection. Maintain the position of the needle tip adjacent to the bladder neck and fully retract the rotatable sheath over the needle. Retract the needle distally into the rotatable sheath, taking care to maintain the position of the Bulkamid system in the urethra. Gently press the Bulkamid system parallel against the urethral wall until mucosa appears in front of the needle tip. The bevel of the needle should be facing towards the center of the lumen at all times. To avoid angulation of the system, ensure the urethral meatus is centered on the screen throughout the procedure. Advance the needle into the tissue parallel to the urethral wall until the 1 centimeter mark on the needle is aligned with the tissue surface. Inject the Bulkamid hydrogel into the proximal part of the urethra until the tissue reaches the midline of the lumen. The needle can be retracted immediately without displacing the gel. To avoid overfilling the bladder and causing discomfort to the patient, close the water inflow and open the outflow between injections. Hold the Bulkamid system in place, only rotating the sheath to the next location while maintaining the level of the Bulkamid system in the urethra. To ensure all injections are placed at the same level in the urethral wall, the first injection site may be used as a guide for the level of the second and subsequent injection sites. This injection procedure is then repeated until 3 or 4 Bulkamid cushions are placed and urethral coaptation is achieved. Bulkamid is a non-particulate homogeneous hydrogel consisting of 97.5% water and 2.5% cross-linked polyacrylamide. It has been shown to benefit women of all ages suffering from urinary incontinence. In particular, it is suitable for women suffering from stress urinary incontinence, stress-dominant mixed urinary incontinence, mixed urinary incontinence, and recurrence following the placement of a mid-urethral sling. Bulkamid has demonstrated efficacy of greater than or equal to 80% when used as a primary procedure and has a strong safety profile with no reports of gel migration, erosion, calcification, or other chronic tissue changes associated with particulate bulking agents. Additionally, Bulkamid has shown durability over time, with efficacy rates maintained at 5 and 7 years. After the Bulkamid procedure, the patient's bladder should be emptied with a soft disposable catheter, Charrier 10 to 12. Patients may resume normal work and daily activities within 24 hours of the procedure.